Minister, as you know, I'm a past member of the COVID committee, which you are yourself, and I think your tenure was shorter than mine, but nonetheless there were a very large number of issues covered there in terms of our COVID response. I'm also a present member of the Enterprise Committee, and in that role I hear the pleas of business and the very great difficulties that businesses are having, particularly small business sole traders, and who are looking to see a pathway to get back operational as soon as possible. And I think I've had on a number of occasions expressed my frustrations, as many other deputies have, with NPHET and the sole authority that NPHET has been guiding our COVID response. But I'm not going to go back over the fallout of all the COVID measures that we either didn't implement in time or we half-heartedly implemented along the way. They have been well documented, but there's been a tremendous social, physical and business fallout to COVID, as we know. And I think it beggars the question, what is it that we want now nationally? What is it that people are looking for? What are we hoping for? And I think there's no doubt that the vaccination drive has now begun to offer us a window out of COVID, albeit that the Delta variant is becoming, I suppose, really a note of concern to that. So I think what's interesting now is that we have, and government appear to be taking the decision, that's what they're proposing tonight, is to open up indoor dining and restaurants, and I think we've all heard already all the different facets of difficulty that's bringing, not least the discrimination. I have a suspicion that for a lot of businesses it will not be viable for them to do this. I think by the time they take on the people to police their doors, implement the social distancing measures, all of that, they're going to find that a lot of people may not want to move indoors just yet, but I think they have to be offered some possibility to do it, but it has to be done safely, and the question is that what we are doing now? I think also we could ask the question about what's not opening up. The elderly daycare centres, increased hours in respite, the increased disability that's being asked for, which has been refused to date, the bingo halls, the arcades, which are asking when is it their turn to be allowed to open up to the degree that hotels are allowed to have people on their premises. And the other question that needs to be asked, Minister, is what is the hospital defence to a surge now in COVID? We can see even in the last number of days a very strong uptick in COVID presentation, an increase of 3 patients overnight to ICU. And I'd like to know, what are the age ranges of those patients? Assuming that the older vulnerable patients are vaccinated, do we know what the impact COVID is now going to have in terms of younger cohorts and those that are vulnerable, that are exposed? We also have the issue of discrimination around vaccination status has been already highlighted. And I've spoken, as other deputies have, to a number of people in business who said it's going to be impossible for me to stand at my door, ask for vaccine status. Out of a group of 8 people coming in, 2 can't provide it, and I'm going to say, no, you can't come into my premises. So I just wonder how workable all of this is, Minister. And it beggars the question too, are we all in this together? And I've asked and I've highlighted that as public servants, we have suffered no diminishment of our pay and conditions since all of this started, unlike very many other people in the private sector, and I think they have to be listened to, but again it has to be done safely and it has to be done for the right reasons. And also, Minister, I don't understand businesses that presently are claiming the CRIS. If they decide to open, I assume that they can't claim it, and if it's unviable and they go to close, will they be able to go back and claim it? Or what are government's plans to extend that or not to extend that based on this reopening date? So I think questions remain around what it is, what we want and what we need, but I think COVID is now definitely being used as a weapon of political intent. And I and other deputies today have been inundated with people from both sides, trying to, I suppose, elicit a response as to where we are. And in my own case, I have not made a decision as yet, because I can see significant difficulties for operators here. I can see discrimination. On the other side, I can see the case for businesses that want to get back and want to get activated. But I do think, Minister, that some of this is resides at government store. It's been largely about the lack of communication, certainly a direct line of sight between the public and NPHET, other than NPHET's coming out and telling us what they have brought forward. I have a number of times highlighted consultants who are out there in the public space, who have done work in antigens, have done work in vitamin D. They've had no operation, no ability to connect with NPHET, and I think that is a deficit. So I think, Minister, tonight will tell the story of this legislation. I don't think it's a perfect solution. I will consult with other deputies later today to see how I will vote on it.
Thank you.